First of all, I would like to say thank you to Almighty God who has given us His gracious mercy so that we can do our presentation. So these are the members of small group discussion B3. Our topic is bleeding time and clotting time for hemostasis evaluation.
Hello, my name is Ibnu Dharma with next 3-digit number 083. Background. Our body have mechanism to control bleeding site when injury happens, and it was called hemostasis. Hemostasis is a blood clotting process that prevents excessive bleeding after blood vessel damage. Normal hemostasis consists of several regular processes that end in the formation of blood clot that limit bleeding from injury vessel. To evaluate whether the hemostasis process is running normally or not, we can use bleeding time and clotting time as the indication for normal hemostasis. If the clotting time or bleeding time is abnormal, it can be an indication of a disease such as thrombocytopenia, von Willebrand disorder of blood vessel, disorder of platelet function, and afibrinogemia.
My name is Arya Tabina Putri Wigianto with the last 3-digit name is 081. I will explain about the formulation, objective, and benefits. So the first one is formulation. The formulation is what is the definition of hemostasis, what is bleeding time and clotting time, what are the clinical significance of bleeding time and clotting time. The next one is objectives. The first one is to understanding the definition of hemostasis. The second one is to understanding the definition of bleeding time and clotting time. And the last one is to understanding the clinical significance of bleeding time and clotting time. And for the benefit, is to show the description of bleeding time and clotting time for hemostasis evaluation. This literature covers the definition and clinical significance of bleeding time and clotting time, and also provides information about the mechanism, the procedure, and the clinical significance of bleeding time and clotting time tests. We believe that this literature can improve the knowledge of medical students about the bleeding and clotting time. Hence, we hope this literature will bring better improvement of clinical prevention and treatment of this disease.
Hello, my name is Gregoris from Tama with last digit name 085. Now, I'm going to explain about the role of bleeding time and clotting time in hemostasis. The bleeding time and clotting time in hemostasis are affected primarily by primary and secondary hemostasis. The body system initiates primary hemostasis to prevent excessive bleeding. If injury occurs, the blood vessel will constrict to limit the blood flow. Then, the vascular cells will release the von Willebrand factor, which circulates and binds with factor VIII, collagen, and any other endothelial substances to create a platelet plaque. Then, secondary hemostasis forms an accumulation of fibrin to stabilize the former blood clot by coagulation cascade. That's all from me. Next slide will be continued by my colleague.
My name is Gede Arya Diva Dhananjaya and the last 3-digit of name is 075. So now, I would like to continue the explanation from my college. It's about the bleeding time and clotting time represent the quality of hemostasis, where the bleeding time represents platelet counts, platelet function in platelet blood formation, arteriolar vasoconstriction that initiate primary hemostasis. Meanwhile, clotting time represents platelet formation that begins with platelet adherence and addition, deposition of fibrin with fibrin mesh formation, and clot stabilization and resorption by creating permanent plug.
My name is Dewa Naraswari Mesi with 3 last digit of name 074. Bleeding test and clotting test examination are usually carried out before certain medical procedures such as surgery and dialysis. It aims to determine the time required for blood clotting of the body. This examination was isolated into 2 types, which is APPT or activated partial thromboplastin time and ACT or activated clotting time. Both of these types can be utilized to screen patients who are given heparin during the CPP or cardiopulmonary bypass.
First of all, let me introduce myself. My name is Erika Luis Adiwati with 3 last digit name 089. Now I will explain about the procedure of bleeding time test. So basically, platelet function is is examined using a clinical laboratory test called bleeding time. It entails making a standardized incision and timing the stoppage of bleeding. The method that I will explain here is Duke's method, and for the materials needed is equipment for sterile finger puncture, and for the tools needed is bleeding paper or filter and stopwatch. For the procedure of Duke's method, firstly, we need to make a small cut at the earlobe by a lancet, then blot the blood from the cut on absorbent paper every 30 seconds intervals. Next, we can control the size of the incision by making the size of the first blot of 1 centimeter to 2 centimeter in diameter, and then the decrease of hemorrhagic tendency can be shown by the rate of the decrease in size of blood on paper, and the total time for bleeding to stop is called the bleeding time. And this method has a number of advantages over other techniques, including a simple procedure that requires no special equipment, a low cost, and minimum scarring. That's all from my presentation. Next slide will be presented by my colleague. Thank you.
My name is Carissa Sutedja with last digit number 080. I will now explain about the IV method. The IV method is the most widely used test of hemostasis. To do the test using this method, the patient's arm is initially placed at the heart's level, and the blood pressure cuff is then inflated to 40 millimeters Hg. After that, the volar forearm is cleansed with alcohol before making an incision 10 millimeters long and 1 millimeters deep using either a scalpel or a lancet. Every 30 seconds, the blood is absorbed. The timer is then stopped once the bleeding stops. Although the IV method is more accurate, it has a higher risk of leaving scars. The normal value of bleeding time is usually less than 8 minutes. If the bleeding time is more than 10 minutes, it is a cause of concern. The next part will be explained by my colleague.
My name is Wahyu Widyasari with the last 3 digit of name is 086. Today I'm going to talk about procedure of clotting time test. Clotting time is the amount of time it takes for a blood sample to coagulate in vitro. There are a couple of methods for performing a clotting time test. First one is slide method. This test is sensitive to the factor involved in the intrinsic pathway. Tools used are slide or glass objects, stopwatch, cotton, syringe, alcohol, and needle loop. Material used are venous blood without anticoagulant. The procedure. First is draw venous blood and start the stopwatch. Place blood on the slide or glass object. Hook blood every 30 seconds and stop the stopwatch if fibrin threads appear. Second is prothrombin time test. PT measure clotting time after plasma citrate is added thromboplastin. PT is sensitive to the clotting factor extrinsic pathway. Tools are tourniquet, syringe, needle, centrifuge tube, micropipette, test tube, water bath, and stopwatch. Material used are platelet pure citrate plasma, tissue thromboplastin, and also buffer. Procedure. First is plasma making. Homogenize natrium citrate and also venous blood in the centrifuge tube, then spin. Second is preparing thromboplastin solution. Homogenize 1 vial of RGT and 1 vial of BAF, left at room temperature for 30 minutes. Third is prothrombin time procedure. First is put test tube and RGT into water bath until warm. Second is put plasma in the test tube, leave it for 3 minutes in a water bath. Put RGT and plasma in the test tube and turn on the stopwatch. After 10 seconds, tilt the test tube and stop the stopwatch if fibrin threads are present.
My name is Desylia Widyasari with 3 last digit of name 084. Right now I'm going to explain about capillary method and activated partial thromboplastin method for clotting time. I'm going to explain about capillary method. This method using some tools such as sterilized disposable needle or lancet, stopwatch, capillary tube, cotton swab, and 70% ethyl alcohol. The normal average of clotting time using this method is 1 to 5 minutes. I'm going to explain about activated partial thromboplastin time test. These tests have a purpose that to measure and detect coagulation factor deficiency in plasma, especially for intrinsic pathway, including factor 12, 11, 10, 9, 8, 5, 2, and 1. The materials that we need for this test are platelet pure citrate plasma, reagent 1 APTT including rabbit brain cephalin, allergic acid, buffer, and sodium acid, and then reagent 2 APTT that including calcium chloride for 0.02 mol per liter, mol range of activated partial thromboplastin time that start from 22 until 27.9 seconds.
Hello, my name is Guptha Dharma with my last 3 digit of name is 087. I will explain about modified Lee and Wayan method. The principle of this method is counting time from the first blood enter the syringe until the blood clotting on the third tube. Reagent and equipment needed: first water bath, temperature at 37 degrees Celsius, glass test tube, 3 pieces, stopwatch, and plastic syringe and 20 gauge needle. Specimen: fresh whole blood about 3 ml. Then do the procedure from first step until the ninth step. Normal range result from this method is 5 until 12 minutes, and then there is some advantage and disadvantage from this method. Advantage: more accurate and standard method. Test can be run without control, and the disadvantage is the temperature should be maintained because higher temperature accelerates clotting, and the diameter of the glass tube should be uniform.
Hello, my name is Aisyah Lathifah with 3 last digit number is 076. So I'm going to discuss about clinical significance of bleeding time test. Bleeding time is a clinical laboratory that shows the duration when the bleeding starts and over to evaluate platelet function. It used to evaluate how good someone's blood clotting was. There are some indications that make prolonged bleeding time, such as deficiency vitamin K, thrombocytopenia, disseminated intravascular coagulation or DIC, plasma thrombocytopenia, Bernard-Soulier, and von Willebrand disease. Deficiency vitamin K. Vitamin K is involved in blood clotting process. Deficiency vitamin K will lead to inability of human body to synthesize vitamin K dependent coagulation factor. Factors coagulation is factor 2, 7, 9, and 10. This will lead to a prolonged bleeding time. Thrombocytopenia. Thrombocytopenia is a condition where there's a low blood platelet count in vessels. The function of blood platelets or thrombocyte is to control blood clotting and heal the wound and stop bleeding. If there's only a small amount of thrombocyte in the body, thrombocyte can't do the job properly and lead to a prolonged bleeding time. Disseminated intravascular coagulation or DIC. DIC are classified into 3 processes based on the etiology: endothelial cell injury, which activate the intrinsic clotting system; tissue injury, which leads to active the intrinsic clotting system; red cells or platelet injury, which release coagulation factor; and damage or abnormality in the IC process will suppress and lead to prolonged bleeding time. Von Willebrand disease. Von Willebrand factor is a factor which helps platelets to stick together and adhere at a site of injury or wall of blood vessels. If there's an abnormalities in von Willebrand factor, will lead to inability platelet to make an aggregation and form rollers, hence make a prolonged bleeding times. That's all from me. Thank you.
Hello, my name is Diva Guptha with the last 3 digits of name 072. So right now we're talking about the clinical significances that are available in clotting time in some certain patients. So by knowing the clotting time of the patient, we can, first one is that we evaluate the bleeding disorder. The second one is that we can examine the individual's bleeding risk prior to the procedure of surgery. The third is that we can identifying disorder in coagulation system, which is its main goal in clotting time. And then the fourth is that it can be used to guide replacement for routine tests. But talking about the coagulation time, by knowing this time of the evaluations, we can conclude of which the disorder that the patient have in coagulation system. For example, this disorder can be caused by the vitamin K deficiency, hemophilia type A or type B, anemia, sclerosis, defect of or deficiency on coagulation factor such as factor 5, factor 12, and etc.
My name is Indirawan Anantaseno with last 3 digit name 091, and the conclusion of our student project is hemostasis is the process of blood clotting that has a purpose to prevent excessive blood loss because of vessel damage. Bleeding time and clotting time play an important role in hemostasis. Bleeding time provides information about the platelet count and its function to perform a platelet plug, and there are 2 procedures in checking bleeding time. There are the IV method and the Duke method. And then clotting time provides information about the quality of the clotting information, and there are various methods to determine the clotting time, such as live method, prothrombin test, capillary method, activated partial thromboplastin test, and modified Lee and White method. And there are the advice of our student projects. There are the writer suggested before doing any surgical procedure on a patient, the patient's hemostasis need to be taken into consideration. The measurement of hemostasis need to include the bleeding time and clotting time of the patient.
Okay, that's all of our presentation. Thank you for the attention.